Go.
Hi, my name is Lauren Stanley. I'm a nursing student at UAM, and I'm just going to be changing your ostomy site today. Before we begin, can you go ahead and verify your name and your date of birth for me? Okay, so that is the correct name and date of birth. First, I'm going to perform hand hygiene and put on a new pair of gloves. So I'm just going to fold down the linens to expose the ostomy site. And once I've done that, just redirect the patient. I'm going to get this pad and put it over the patient. Just going to tuck that in. So I have a drainage cup right here. I'm going to remove the clamp. Okay. I'm going to go ahead and drain the stool from the side. I'm going to work from top to bottom. Okay, after that is all emptied, I would dispose of this in the toilet and document the color, consistency, everything. So next I'm going to get the off, and I would dispose of this in a biohazard bag. And I would get the silicone adhesive remover. Not that one. And I would go ahead and remove the wafer. I'm gonna pull with one hand and wipe with the other, working from top to bottom. Okay, after that's been removed, I'm just going to dispose of this in a biohazard bag. And I'm going to inspect the skin for any redness or irritation or any rashes. And I'm going to remove my gloves and perform hand hygiene. Put on a new pair of gloves. After that, I would go ahead and get a skin cleansing agent with a pH of 5.5. I'll go ahead and clean the skin. After that, I would dispose of that in a biohazard bag, and I would just allow it time to dry, and if there's any excessive bleeding, I would go ahead and report that to the doctor. So next, I'm going to measure the size of the stoma. You want to go a little bit larger than the actual size. So I think this one would be good. And I am going to place a gauze pad over the area just to cover it while I trace the size. So I'll open the new wafer. And I will go ahead and take off my gloves and perform hand hygiene. And I'm going to trace. After that, I'm going to take it out and I'll cut it. You want to try and make sure that you're getting a nice clean circle with no rough edges. Okay, and I'll dispose of that in the biohazard bag. Just try and clean it up some. So once you have a pretty neat circle, you are going to set that to the side and remove the gauze and dispose of that in the biohazard bag. And you're gonna get the Ostomy skincare product. You're gonna go ahead and apply that to the site. You can also use one of these and wipe the site with it and dispose of that in the biohazard bag. I'm gonna go ahead and take these gloves off and perform hand hygiene and put on a new pair of gloves. And after that, I'm going to peel the paper off, the new wafer. This card. I'm gonna go ahead and apply that to the site. I'm gonna hold that down for anywhere between 30 to 60 seconds. Just make sure that it's on there really good. Okay, after that is down, I'm going to put a new bag on. Make sure that it's on there good. I'm going to remove my gloves, perform hand hygiene, and put on a new pair of gloves. After that, I am going to remove this towel. And dispose of it in the biohazard bag. I'm gonna take my gloves off and perform hand hygiene. And I will go ahead and re-drape the patient and put them in a low, comfortable position with the call light in reach.